Colon cancer. It is the third most common diagnosed cancer in the country. In fact, each year more than 50,000 people die from colorectal cancer.
March is Colon Cancer Awareness Month, and as Shelley Botat tells us, it's a good time to find out when you need to get screened.
A lot of people put off getting a colonoscopy for a variety of reasons. They don't have any symptoms of colon cancer, or they're afraid, even embarrassed, to get the procedure. But not getting screened when it's recommended could put your life at risk. Jim Schaetz knows at what age most people should get their first colonoscopy.
Well, you hear the reports about people should have a colonoscopy, and when you get 50.
But Jim said he was chicken to get one.
You hear the horror stories about things, and I was still leading an active lifestyle and never put it off, and not admitting to myself that I was actually 50 years old.
Finally, at age 59, Jim decided it was time to go to Aurora BayCare Medical Center for his first colonoscopy. A smart decision, says gastroenterologist Dr. Jay Boscoe.
Most colon cancers, in fact, are preventable if patients have undergone adequate and an appropriate type screening and followed screening recommendations.
If you have a personal history of polyps, a genetic predisposition like Crohn's disease, or a family history of colon cancer, you should get screened before you're 50. There are some warning signs of colon cancer, like rectal bleeding, pain, bloating, or diarrhea. But the problem is the most common symptom is no symptoms. So getting screened could save your life.
The risk of colon cancer drops dramatically, up to 90%. In those patients. So it has a very strong protective effect in subsequent development of colon cancer.
And there is nothing to be afraid of. A colonoscopy is an outpatient procedure that takes about 20 minutes under sedation. Jim got a clean bill of health and recommends others get screened.
You probably would hate to say to put it off and find out there is something, and you're thinking to yourself, why didn't I come in sooner?
Now, those who are at average risk should get a colonoscopy every 10 years. Those with an increased risk of developing colon cancer generally get screened every 5 years. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. In the studio, Shelley Botat, Local 5 News HD.